Welcome, welcome all to March's BayCare Presents. I'm happy to introduce Dr. Fred Brennan, and he's going to be talking about The Heat is On, strategies for dealing with heat injuries. Thank you.
Thank you so much. It's nice to be here. I appreciate the invitation. And, thank you for the shout out. I did retire from the military. I did 12 years on active duty and then 9 years in the Air National Guard to finish up my time. And I have to admit that I was deployed a couple of times to some very hot environments. And I'll make a comment about one of the places that actually was probably the hottest place I've ever been, and that actually was in the United States. But we'll get to that a little bit later. I think right now we're all enjoying this nice cooler weather, but it won't be long. As we all know, that we'll be dealing with the heat. And one of my other side jobs as far as dealing with heat injuries, et cetera, is I am very fortunate to be one of the chief medical officers for the Boston Marathon and also the Ironman Triathlon World Championship in Hawaii. And certainly we've seen our share of heat injuries both in Hawaii and, believe it or not, the Boston Marathon, even though it's April. And we've learned a lot of lessons about how to deal with heat, preventing heat injuries. But sometimes we do all the right things and we become a casualty of some sort of heat problem. So we're going to talk about a couple of things. I imagine most of you have experienced, hopefully, just maybe heat cramps and or heat exhaustion. And I hope that none of you have ever been a victim of heat stroke, a much more serious condition. We're going to talk about how to recognize sort of when you're getting in trouble. Like, first of all, let's prevent you from getting in trouble in the heat. But if you start going down that pathway of going from heat exhaustion to maybe heat stroke, recognizing a friend or a colleague who you may be working with or walking with or something, I want you to be able to recognize that that person is in trouble and to get them out of the heat and prevent something like a heat stroke, which is definitely the most concerning of the things that we're going to talk about today. So we're going to talk about heat cramps, heat exhaustion, heat stroke. I think there's a lot of misconceptions about what heat exhaustion is versus what heat stroke is. We're going to talk about how you acclimate to the heat, because I think that's really important. I think some of us just, we've been cooped up inside. Yes, the winters are relatively mild here, but what happens is we go out on a hot day and we think we're all good, but the reality is your body has to acclimate and get ready to deal with the heat. Not only your water intake, your fluid intake, but also the amount of time you spend in the sun. You should acclimate or rev up your volume little by little so your body can adapt to that. And we'll talk about that. And then hydration. How do we stay hydrated? What do we use for hydration? What should we not use for hydration? I'll give you some guidance there as well. So first of all, who are those folks that are more highest risk for being a heat casualty or having heat injury? Well, obviously, hot, humid weather, right? So getting out in the heat of the day and deciding to exercise when you maybe should be doing that in the early morning or late when the sun goes down. But when it's hot and humid and you can't really allow evaporation to cool you, that is a problem. Obviously, hot, humid days are the most at risk. People over 65 and kids under 2, those are the highest risk. We don't have the ability when we're older or younger to regulate our body temperature nearly as well as when the other stages of life. So those folks that are over 65 and young kids certainly are the most at risk for heat injuries. If you have a chronic disease, high blood pressure, diabetes, some sort of cancer, that does make you higher risk for becoming heat injury. Pregnancy, obviously, there's a lot of changes in pregnancy, and so women who are pregnant should be careful of exercising in the heat and the time of day. Manual laborers, folks that are work as you can see, a roofer here, those who work in paving or outside exposed to the heat, higher risk. Exercising, again, in the heat, you got to be careful about the timing of the day and how hard you push yourself. And especially those sports that have equipment like football where they're wearing helmets, etc. If you become dehydrated or you're not taking enough fluids in, if you've been drinking heavy the night before and you're a little dehydrated, that puts you at higher risk. And stimulants like Adderall for ADD, ADHD, and some diuretics that might make you become a little fluid depleted because of, that's the idea, is to get rid of excess fluid, but not too much, could put you at higher risk for becoming a heat casualty, if you will. So heat cramps, a lot of debate, what causes cramping? Well, one thing we find that it probably is not is the old wives' tale of you need more potassium. It really is not the player here is causing cramps, especially heat cramps. If you do studies, they've done serum blood testing, etc., it's not really low potassium. It's okay to have a diet that's, a decent amount of potassium, but you don't lose a ton of potassium in your sweat. You do lose a lot of sodium or salt in your sweat. And certainly, if your muscles are hot and you become fatigued and you're a little dehydrated and you've been sweating like crazy, losing a lot of sodium in your sodium in your sweat, then you're going to become sodium depleted. There's also some thought that magnesium may play a role in that as well. And medications such as the statins, atorvastatin like Crestor, which is Lipitor, rosuvastatin, which is Crestor, those may make you at more risk for getting muscle cramps, especially if you get dehydrated. So the reality is, um, we think, well, I'll have Gatorade. I'll just drink a lot of Gatorade, and that has sodium in it. Well, it does have some sodium in it, but not a lot. You can't put too much sodium in those drinks because it's not palatable. Although when we're working with I do work with Tampa Bay Buccaneers, we do add extra sodium to the Gatorade, even though it's just on the verge of not too great to drink, but you do need that extra sodium. I tell people sometimes eat pretzels when they go out and exercise in the heat when they're losing a lot of sweat, especially over an hour. If you're out in the heat for an hour or more, hot day, you're sweating a lot, you're going to lose sodium and water. You have to replace the sodium as well. As far as, let me just go back here. As far as treating your heat cramps, stretching, getting out of the heat for a while, ice massaging, that all helps. Drink some fluids, including stuff that does have sodium in it. Maybe add a little magnesium. There are supplements for magnesium. But if you're a frequent cramper in the heat, you definitely want to make sure you're drinking enough fluids, adding extra sodium if you're out there sweating, and maybe adding a magnesium supplement to your diet as well, as long as you don't have any kidney issues that would make you stay away from those things. But stretching, icing, cooling off. And then again, sometimes it's just muscle fatigue. You're doing something that you're not used to doing. Maybe you've walked a mile a day most days of the week, but then you jumped in it might be a hot day to a 3 or 4 mile walk. You might have done a little bit too much and you've cramped up because of that. So it's kind of a continuum from people will get heat cramps, then they'll develop sometimes heat exhaustion, and the next level of the spectrum we'll say is heat stroke. So when you become heat exhausted, usually you're sweating a lot. You start to feel really tired. A lot of people get a headache. They feel sluggish. They feel kind of off. They feel kind of slow. But usually you can see someone that you may be working out with or exercising with that you can see they're starting to fade. It's hot out. They're getting tired. Again, they maybe get a headache. They just want to sit down and rest. They're sweating profusely. More likely, it's the early stages of heat exhaustion. And these are the folks you're going to want to recognize and listen, you look really tired. Are you okay? Like, yeah, I'm pretty worn out right now. I'm hot. I feel sluggish. I got a headache. I might feel a little nauseous. That's on that spectrum of, listen, this is your body telling you need to get out of the heat, get some rest, even if it's just 10 or 15 minutes in an air-conditioned room or your car. And then if you feel okay, you can go back out again. But if you push it beyond that and go too much longer, there's always the risk of becoming a heat casualty in the form of a heat stroke, which we'll talk about in a second. Um, so again, if you're feeling heat exhaustion, the key is to get out of the heat. If you've got extra layer of clothes on, take those extra layers of clothes on. If you're exercising the heat, good to wear a hat, wear white clothes or light clothes that don't absorb heat like black does. But get yourself out of that heat environment. Exercise in the heat is okay, but you should do it with caution and probably best to do it in the early morning hours or after the sun is just about ready to go down in the cooler parts of the day, as opposed to in the middle of the summertime, right at 1 or 2 o'clock in the afternoon. You're putting yourself at risk. This is a video, as I mentioned, every other year I go out to the Ironman. I actually competed in 2002 and really got to appreciate how hot it gets out on the course. the Ironman Hawaii is the world championship, and the bike course and the run course goes through some lava fields, and the temperatures are in the 85 to 95, even 100 degrees, with a lot of wind and a lot of radiant heat. And this is an example of someone I took care of in the medical tent. I wasn't at the finish line when it happened. I was actually in the medical tent. Very graphic video of a heat stroke, which we'll talk about next. But I'm going to play this video, again, rather dramatic, of someone who is exercising and has pushed themselves too far. And when I tell you what their body temperature was later, you'll all be in awe. But let's go with the video. Hopefully you can see this and hear it. It takes about 30 seconds or so to see the person's going to be down at the bottom of the screen over here. Pretty soon you'll see the young lady. Here she comes now. Really struggling here. She can't really get up, but she was making forward progress. So quite dramatic. So folks will say, well, why didn't anybody do anything? So, they've trained hard and for a long time, and you give them the benefit of the doubt as far as if they're making forward progress. Where the finish line is right there, it's really hard to tell where the finish line is. Is it that little arch, or is it before that? Um, from our standpoint, we're down the ramp to the right that you saw earlier. The reality is you can't really see what's happening on the other side. We've since changed that. I was back at the Ironman this past fall, and we changed that so that we have a spotter, which I was the spotter to the left here, where we could actually see if someone was really getting in trouble. So by the time they really recognized that she was there, still making forward progress, but finally said, listen, we got to go intervene. Those are some spotters that will then bring her to the medical tent to be evaluated. But we try to let them go as far as they can, as long as we're not putting them at risk. And obviously, she was trying to make forward progress to the point finally she couldn't do that. But when we got her into the medical tent, we do have a heat deck with ice water immersion, and she was very confused. She had no idea where she was. Wasn't really responding very well to questions. She was weak. And her core temperature, again, we don't use ear thermometers or temporal. It really is not accurate in this environment. You actually have to do what's called a rectal thermistor. It's a rectal thermometer that stays in and monitors their temperature, because the idea is how hot are they and how quickly can we cool them off. And her core temperature, her body temperature is 109 degrees. And so this is a heat emergency or a heat attack. You can't let someone bake like this for long. You really have to cool them off. So for you all, if you recognize someone who is exercising in the heat or working in the heat, and then they start becoming confused or wobbly or slurring their words, they may or may not be sweating. They may be sweating profusely. They may be dry and hot. Either way, if they're acting funny and unusual or really look unsteady or have a severe headache and you're working in the heat, you really need to assume that this has progressed to a heat stroke, and that's a medical emergency. You need to get them out of the heat and help them, or hopefully not yourself. Usually it's associated with a temperature of 104 or higher, again, core temperature. Really, they're out of it. There's mental status changes. They are confused, they're irritated, they're irritable, they're not answering questions appropriately. We've had folks at the Ironman pull off the course because they were staggering. Again, they're not always sweating, but sometimes they are sweating profusely, and sometimes we've had them come in actually having a seizure. So the key for all of you is to recognize in yourself or when someone's in trouble that they may be a heat stroke. And obviously, if someone collapses in the heat, you always have to think about your heart and whether it's a heart attack. And to do something, assess if they have a pulse or not. If you feel comfortable with that, if they have no pulse, then you have to start CPR and go from there. But assuming they collapse and they do have a pulse and it's the heat, um, much more common than hypoglycemia in the heat environment is heat stroke. So really, really get help quickly. Get someone to cool them off, get them out of the heat, and
Dr.
get them
Brennan,
checked out.
would
Yes.
this also be a time where we should be dialing 911 at this time and getting some professional medical attention to this individual?
Yes, if someone collapses, I think you can, if depending on your comfort level, you can do a quick assessment to see are they responsive. Do they answer questions? If they're not answering questions, and again, you feel comfortable checking a pulse and they don't have one, please, start CPR, call 911, try to get an external defibrillator. Um, but if you just don't know, and I know you don't feel comfortable checking a pulse, but they collapse in the heat, absolutely. Call 911, get some help, have someone professional come take a look at it. And there's a good chance, yes, it may be a heart attack, maybe a stroke, but if it's otherwise young, healthy person who's been exercising hard in the heat, this is a very high possibility that could be a heat exhaustion or heat stroke. And
When I teach CPR, I always say that you can't die of embarrassment. If you're wrong and this person didn't need 911, they can say no, we don't need it and they leave. But if you're ever in doubt, I think it's always a good thing, as you were saying, just get someone there who can help.
Absolutely, absolutely. And we know that not everybody feels comfortable assessing someone who collapses, but certainly if you see it and you go try and you try to arouse them and they're totally not responsive, absolutely get some help. And even if they are responsive, but they seem confused and really out of it, definitely call for help. There's no reason to be a hero and take a chance. Like you said, no one's going to criticize you for calling 911. They will if you don't. Something bad happens and you're right there. So um, I think the key is with heat stroke is to recognize it as early as you can and then definitely start treatment. So we've talked to EMS services here regarding like when it comes to high school athlete who collapses in the heat, and there's a big controversy about not checking the core temperature because it's a little invasive. It's rectal temperature, and on a high school athlete, it makes a lot of controversy. So EMS in the past has been really taught to do a quick evaluation and scoop and get anybody who collapses out of there for a quick assessment in a hospital setting. But we've talked to them about in a heat-like environment where it could be heat stroke. It's okay as long as they're breathing and they have a pulse and it's in the heat, assume it's a heat injury and start cooling first. And then cool them off in the ambulance on the way to the hospital, but don't wait for 20 or 30 or 40 minutes to start cooling them if you think it's a heat stroke. So for folks that are out there exercising and something like this happens, again, first step if would be 911 if it's really a bad situation. But if they just look a little out of it, get them out of the heat into a cool environment. You can even cool them, just with wet, cold cloths on their face and on their trunk just to get things started. Um, but this is again a heat stroke is like a heat attack, and the more time their brain is frying, if you will, at 106, 107, 108 temperature, the worse the outcomes. So we definitely want to get people treated as quickly, recognize it as quickly as possible, and treat it as quickly as possible. This is something, a tank that we use, for example, at the Ironman ice water immersion. I don't expect anybody out there to be doing ice water immersion, but certainly if you have a cold hose or you can use a mister, you can use a fan, you can get them into your car with air conditioning. Someone, for example, that's heat exhaustion. Um, just get them out of the heat, take off some layers and start to cool them. We used to think that if we put people in the ice water immersion that it would make them shiver and create more heat, and that's a bad thing. That's been found to be an old study from like the 30s and really not accurate at all. Ice water immersion is really the quickest way to cool somebody down. But the big thing here, this is sort of the no sweating versus sweating, not necessarily true. You could still be sweating and be a heat stroke. Usually you say 104 temperature with mental status changes, meaning they're acting weird, they're out of it, they're stumbling, they're not talking coherently. Again, call 911 and get them care immediately. So prevention, so that's a key, right? Is not to treat this after the fact if possible, it is, but to prevent you becoming a heat casualty, whether it's heat exhaustion or heat stroke. I mean, right time of day is key, right? If you have an option of exercising in the cooler hours of the day, that's the time to do it. There's no utility in putting on the sweatshirt and sweatpants and say, I'm just going to sweat it out. This is going to be good for me. I'm going to sweat it out and go out at 12 in the afternoon. There's no benefit physiologically for you to do that. But so right time of day is very, very important. Dressing appropriately, light clothes, layered clothes. If it's cool in the morning, if it's becoming hot as you work out, be able to take those layers off. Clothes that wick moisture away. Cotton and wool, not great. Cool Max or something like a Cool Max, a wicking material to get the sweat off your skin to evaporate will help you. We talked about acclimating. So acclimating doesn't mean you walk from your car into Target and, I got my 5 minutes of heat exposure for the day. It does take your body some time to get used to the heat. Typically, it's going to take a couple hours of exposure every day in a warm, hot climate. And it can be in steps. You could work for 15 minutes and then go inside, go out for 15 minutes later in the day. But you need to get exposed to the heat and humidity a good 1.5 to 2 hours a day for about 10 to 14 days for your body to acclimate and get used to the heat. And part of that is your sweat response. In the beginning, when you're not acclimated, you won't sweat as much, and sweating is a way to cool yourself down. As you get more acclimated, your sweat rate goes up. You will lose more water or more fluid and more sodium, but the sodium concentration in your sweat goes down. So you have that adaptive response a little bit, but you will sweat a lot and more as you acclimate, and that's a good thing. But just remember, it will take you a couple of weeks, 10 to 14 days, and again, some fair amount of exposure to the heat and humidity for your body to get used to it. But that is really key. Starting out slow in the heat environment and working your way up as far as exposure and time in the heat until you get acclimated. Definitely want to, if it's hot out there, take breaks, get yourself out of the sun, get in the shade, cool yourself down. No need to be a hero and go out for 2 hours straight on a hot, humid day. Please take breaks and get into the shade and hydrate up. Medications, be careful with those things. We talk about mostly the stimulants and the diuretics. If you have to take them, you have to take them. Just be aware that it could make you more at risk for having a heat problem. Doesn't mean you will be a heat problem, but you will. Recovering in the cool and having adequate sleep. One of our problems when I was deployed, I was in Iraq for a year, in the desert for 6 months, and in Baghdad for 6 months. But our time in the desert, it was 125 to 130 degrees during the day. At night, it was about 95. And the funny thing is, even though it was 95, which was weird, we were in sleeping bags going, oh, it's cold out. Well, it's because the temperature dropped by 30 degrees. And even though your mind says it's 95, why am I in a sleeping bag? You felt the difference. But we would tell the troops when they had a chance, recovering, getting plenty of sleep and recovering in a cool environment is important, because we did see some heat injuries because these poor folks, these troops were out in the desert and really didn't get much of a break from the heat. And there was some heat issues that we had to deal with, especially with their flak vest and their helmets. And 125 degrees in the desert has its challenges. Okay. Pace yourself. Be aware of yourself and how you're feeling, or if you're exercising with someone, watch your buddy, exercise with a friend, be able to recognize when they're in trouble and get them out of the heat. So some take-home messages here, some of those I just mentioned. Don't ignore your symptoms. If you're feeling like you're getting a headache, you're feeling nauseous, you're feeling a little dizzy, uh, get yourself out of the heat and hydrate up, whether it's water or Gatorade or Powerade. Iced tea, probably not the best. It acts a little bit of a diuretic. Iced coffee, same thing, helps, but the caffeine does have, for some people, a little bit of a make you go to the bathroom, and that's not the key. Alcohol, it's not going to be the best hydration solution. Um, so I recommend you kind of do that in moderation, of course, as well. But if you're out in the heat for a long period of time and you're sweating profusely, water's probably not going to be enough. You're going to want a sports drink that has some sodium. And obviously, as we talked about, there's not a lot of sodium in there. You're probably going to want to grab some pretzels with some salt or something that's salty to augment the Gatorade to get more salt in. Otherwise, you may get cramping as well. We talked about older versus younger folks being more at risk, dressing right, getting yourself acclimated to the heat, and collapse in the heat. Yes, always think about this as a heart attack on someone that happens, but if it's on a hot day, hot environment, after you feel either comfortable that it's not the heart, or if you just don't know, um, just remember heat stroke could be the cause of their collapse. This is the Corey Stringer Institute. Corey Stringer played for the Minnesota Vikings. He was a big offensive lineman that died of heat stroke. Big guy, not probably as acclimated as he could be at the time. Whether how much fluid he had, who knows at the time, but the bottom line is he died of heat stroke. And the Corey Stringer Institute is affiliated with the University of Connecticut, and they do a lot of research and have a lot of guidance on hydration and preventing heat injuries. So it's a good website to check out the Corey Stringer Institute if you want to learn more about heat injuries, prevention of heat injuries, hydration issues, things of that nature. So I think we got through the slides. I don't know how we do for time. Okay, Jemery?
Perfect. You're right on 30 minutes. That is awesome. I know
Perfect.
I have people, but we do have one question in there, but if anyone has any questions that they want to ask, go ahead and type them into the chat. I know I was very interested in this. I had never really experienced any heat issues, and I live in Florida, about in the sun a lot and do a lot of stuff. We went to Utah last year to go hiking, and I prepped to make sure I could walk up high hills because, Florida, we don't get too many hills. So I was getting on
Right.
treadmills, doing on hills, getting outside, doing bridges. And I'm pretty sure I was on my way to a heat stroke because I was getting my kids ready to call 911 for me.
Mm.
And it was a scary situation because I was getting a little disoriented. I was nauseous. We were able to finally find something to put me under shade. We took an easy walk the first day so we wouldn't be going up hills, but it was the heat. And I also, one of the things is I had just finished a round of radiation for
Mm.
the cancer treatment that I had gone through, and I blame it on that. But it was a scary situation of understanding where it was. And I know I went and found, once we got myself back to a place, I hugged a bag of ice for about a half an hour just to try and get my core temperature down. So it can be scary, and there are continuums, but it is something you want to be aware of when we live here in Florida, because even if you're out in the heat a lot, it can sneak up on you when your body's out of whack a little bit. So
No,
someone was,
absolutely.
yeah, go ahead,
Absolutely.
sorry.
You go ahead. I'm sorry.
So someone was asking, when you're out on with the Ironmans, which is very cool. I have a bunch of people that I've trained with those, so I know that they can be very intense. Do you ever check anyone else's temps as they're going through, or is it only when they come in and they're indicating that there's an issue going on?
Yeah, that's brings up a funny story, not at the Ironman, but at the Boston Marathon. So when I briefed the medical tent, so there's two main medical tents at the Boston Marathon, one at the finish line and one about a block and a half away, and that's the one that I'm in the charge of. And so we have our meeting before the race starts, and one of the things I mentioned was that if someone comes in as a collapsed athlete, you bring them in, you put their feet up, you check their vital signs, and you talk to them and see how they're doing. And if they're acting confused or really out of it and they're not responding after a good minute of getting their feet propped up and letting them rest, if they're still very, very confused, but only if they're confused and disoriented, do you then have to check a rectal temperature to make sure that they're not in heat stroke causing it. Now, if it's 30 degrees out, probably not going to be the case. But even in 50s and 60s, we've seen, and I've also worked the Marine Corps Marathon, where one day we had 4 people getting the dunk tanks for heat stroke. It was only in the 60s, and we had another 3 people getting warmed up because they were hypothermic on the same day. So you can get heat stroke in the six when it's in the 60s. So you gotta beware. But at Boston, my thing was that we had very much said, do not check rectal temperatures on people unless they're confused and disoriented and they're not turning around very, very quickly. But if they are that way, you do have to check it. Well, we heard a couple of folks when the race first got our first few folks in saying that, hey, what are you doing? What's going on? Why are you doing this? And I came over to a couple of the cots and said, hey, well, what's going on here? Like, oh, we're just checking a rectal temperature. And I said, is the person coherent? Oh yeah, they're okay. They're talking to us. I'm like, did you not hear me say only check their temperatures if they're disoriented or acting fine? Oh yeah. Like, oh my God. No, you don't need to check those on temperatures at any of these events if they're acting normally and things. So we don't check their temperatures that way unless they are having problems. They have done studies at the Ironman where folks have actually swallowed these internal thermometers, these capsules, and they've done studies monitoring how hot do they get. Part of it is how hot do they get, but how quickly does it rise? And then sometimes it should plateau, their body temperature should plateau, but you got to be cautious for like all of a sudden now it just takes off because the brain's not actually regulating their temperature anymore, and that's the heat stroke.
Wow.
And it's not uncommon for these Ironman in Hawaii and Iron Women to have running in the 102 to 103 range throughout the race. That's their core body temperature. But it plateaus and it stays there, and they're able to continue to cool and hydrate. And with that in mind, they do just fine. So yes, they get hot during those races, but when things sort of fall apart internally is when you start going into now you're getting into heat stroke and all the changes we talked about with heat stroke.
All right, I have a question with a hand up. Stephen, I think I unlocked your mic that you should be able to unmute yourself and ask your question. If not, we're going to have you type it in.
Does that work?
I can hear you, sure.
Yes.
You can hear me. My wife and I took a trip through the Grand Canyon on the Colorado River. She got heat stroke in that she was throwing up, headaches, couldn't keep any food down. Tried Gatorade, and the purple Gatorade, she just threw it back up. It had to be an orange Gatorade, a different one. But when you're on water, you can still get heat exhaustion or heat stroke on water, and she was drinking constantly and diluting her electrolytes at the same time. And at the bottom of the Grand Canyon, any medical issues was going to be like a half hour, 45 minutes away by helicopter if we had to. We were on a raft in the bottom of the Colorado River on a raft at the bottom of the Grand Canyon.
Wow.
She couldn't stand or do anything, so we tried to get her in the shade, not a lot of trees, and she survived.
Well, that's scary for sure.
Glad
And
she's
you're
doing
right.
well.
That can happen. You can even see it in skiers. Maybe it's a spring ski day, it's in the 40s, and you're spring skiing and you still have quite a few layers of a sweater or a down jacket or whatever. And we've seen folks, skiers, overheat as well. I've never seen a heat stroke, but I've seen someone that's been very, very close to heat stroke who was skiing. Um, the other thing you have to be careful for with your fluid intake, especially if you're sweating a lot, is you can dilute your sodium down too much if you don't take in some salt. If say you're sweating a lot and you're drinking a lot, even if it's Gatorade, you can get your sodium in your blood really, really low. And we've seen that in marathoners and our Ironman triathletes before, where they were really pushing water, but not so much electrolytes, especially sodium. and their sodiums get really low and they get confused, they get puffy, they get bad headaches, and it's so bad that we've even seen folks seizing because their sodiums got so low. So a lot of the races now have spread out the watering stations, if you will, so that yes, we want you to hydrate, but we got to be careful that you don't overhydrate and then drop your sodium down. Well, then that's an issue. So that's one of the things we look at in the tent is when someone collapses. If it's we check, one of the things we check is their sodium in the medical tent at the Boston Marathon and the Ironman, along with their rectal temperature if they're out of it. Those are the two big things. And we check their sugars, but rarely do we find someone that's hypoglycemic. During a marathon or an event like that, though, you shouldn't gain weight. Everybody loses weight when they run a marathon. They should, because of the fluid losses. You shouldn't be gaining weight. If your weight after the race is more than before the race, you've probably overhydrated, and that can happen too.
That is awesome. To wrap us up, you want to give us our top 3 or 4 tips that we should remember when we're going out into the heat?
Yeah, I think the biggest thing, would be know yourself and know your limits. You'll be very much aware of what the climate's going to be like for the day that you're out there, whether it's going to be hot and humid or it's going to be dry with a nice breeze. So be very familiar with what you're doing that day and how hard you're going to push yourself, so that you can dress appropriately and have enough fluid with you, that you don't get yourself in a bad place with the heat, whether it's cramps or otherwise. Again, acclimating, starting off slow, building up, get into the heat for a certain amount of exposure so that your body can acclimate to the heat. And just be able to recognize, especially in someone that you're maybe working with in the heat or whatever, if they are starting to go down that path of the headache and tiredness, and or they start to get wobbly or just look like they're overheated, don't ignore that. Just get them out of the heat, start cooling them down any way you can, and then sort of watch them and make sure that they're going in the right direction, getting better and not worse. I think those are some of the key points.
Thank you so much for sharing all that. That was incredible information. We appreciate you being here. We appreciate